South Africa gears up for the rollout of the national insurance. The Health Department and National Treasury are exploring the use of the country's 2.7 trillion rand savings pool to fund upgrades on public infrastructure. The National Treasury suggests that the Public Investment Corporation could be a key funding source. Health Minister Dr. Motsoaledi now joins us to have that conversation. Minister, very good morning to you. Thank you so much for making time for us. The explanation that you also gave was that this is an idea that had been explored about 10 years ago, and now it is back on the agenda. But if we look at the PIC's mandate, which also includes, amongst others, that these are pensioners' money, and therefore that money must yield some sort of profit, are we able to come to a determination around whether any profit will be yielded if the PIC was to become a strategic investor?
Good morning, Aldrin. Good morning to the viewers and listeners out there. Aldrin, indeed, this started long ago during my first stint as a Minister of Health, because at that time, Treasury was giving us 10 billion rand per annum for infrastructure, which, looking at the needs of new hospitals, maintenance, equipment, is a droplet in the ocean. And so we developed this idea that what will happen if we use PIC money, like private hospitals. I'm not sure whether you are aware that a lot of private hospitals got money from PIC. That's why they've got such good infrastructure. That's why they've got appropriate equipment. And that's why people get happy when they go there, because they sit very comfortably in good facilities with good equipment. And so we said, why can't the public also gain from that, scene that some of the money used come from the public itself via the Public Investment Corporation? And we argued that what will happen if Treasury gives us money, we put up all the infrastructure, and every year when they give us this budget, which at that time was 10 billion, then we take half of that to pay back at the PIC. And we can do that for a period of 20 to 30 years, while the infrastructure is being used, is being used, rather than waiting for 10 billion every year, put up one hospital, then wait again for next year, put the second hospital. And that was our argument. Take, for instance, Aldrin, the new academic hospital that is being built in Limpopo is 4.5 billion rand, just one hospital. So if your total amount per annum is 10 billion, I think it's more now, but if one hospital costs 4.5 billion, when are you going to finish to have all the infrastructure you need? Basically, that was our argument. And we're not saying the money must be free. We know very well that, yes, the money needs to be invested. It belongs to pensioners. When they retire, they must get that money back. We can't tell them that, no, that money is being used for health. But we were saying so that we'll be able to pay back. The private hospitals, some of them are not even paying back. They just give equity back to Treasury. So you can't have a situation where public hospitals that are saving, or the public sector that is saving 86% of the population, there is massive disinvestment. But there is investment in the private sector, which is assisting only 14% of the population. That is gross inequity, and we don't think it should go on that way.
Yeah, but what would the return on investment be for the PIC? And would the money go directly to Treasury, and then Treasury disperses the money instead of the money going directly to the department?
Well, they will make arrangements. Those are technicalities for which they will make arrangements. All we are saying is that we are not asking for free money. At that time, Treasury said, no, you can't just say PIC. Let's look at the whole spectrum of lenders, including commercial banks, including, even internationally. And we said, no, fine. As long as we get money to invest in public health infrastructure, we are happy. It's just our proposal that it must be PIC. If you find any other source as Treasury, well and fine, we don't have a problem. So at the moment, that's what they told us. They said they are looking for various sources. But the issue of PIC was us proposing it because we saw it happening to private hospitals.
Yeah, but the private hospitals, of course, they are profit-driven, whereas state hospitals are not necessarily profit-driven. Again, this question around the return on investment, What is it that the PIC would be getting in return for the money that they will be pumping into public healthcare?
Aldrin, I said they will calculate. We never said it's going to be free money. They will calculate. Look at the unfairness of it. The money in PIC is for ordinary workers, some of whom don't even qualify to use private hospital. They can't afford to, but their money is being used to prop it up. And their money cannot be used to prop up facilities where they are getting care. Don't you see the unfairness of this all?
Yeah, we can speak about the unfairness, Minister, but there is still that question about return on investment. I think which is quite critical.
I've answered it.
Yeah, and the question is that what is that return on investment for the PIC, considering that the PIC as well has a mandate towards its funders?
They will tell us what is the return on investment. They will tell us. That's why Treasury said, let's lose all the sources and see which one is cheaper. They will tell us. We never said, give us free money, just fund us. We said, no, borrow us the money, lend us the money like you are lending to all the others. And every year we'll pay up. That's what Treasury and PIC and us need to sit down and work on. We never said it's free money, so there will be return on investment. Only that because these are public funds, it should not be excessive. That is our argument. Because it's saving the very same people who have invested this money.
Okay, and then in terms of the money that you would be requiring from the PIC, if that money does come, would it only be ring-fenced around infrastructure? Would it include equipment? Would it include paying of doctors as well as medical staff?
No.
How do you anticipate it's going to work out?
No. It's purely for facilities, meaning infrastructure and equipment, purely. You can't pay doctors from money that you have borrowed from somebody. It's completely unsustainable. It's simply to put up a facility and put up equipment. Take, for instance, now, Aldrin, we are very scared about what is coming in the form of cancer. And cancer treatment, especially radiation, it needs bunkers. You can't put a bunker. You need to build bunkers. And the manufacturer of that linear accelerator must then come and put the equipment. You can't put a bunker in a hospital that that doesn't have good infrastructure. Take, for instance, even an academic hospital like George Mukari, which is a university, a medical university, by the way. They don't have a single bunker there, which means they can't do radiation. That cannot be allowed to continue. Then in the medical school where I studied, King Edward, you can't put any bunker there, and it has been a medical school from 1953. So these are the things that we should have solved long ago, but we delayed, but it's still time to solve them. Basically, that's what we are looking for. Not money to pay doctors or do any other thing, just to put a facility with infrastructure and good equipment.
Yeah. How far are you with regards to those conversations? Do you know when the deadline is? Perhaps maybe that you're setting yourself to make sure that the money is available?
No. We're waiting. We met Treasury more than a month ago and put up our proposals on the table. And they said they'll come back to us. We know they were still busy with the midterm expenditure framework, the midterm budget. And now it's over. We're expecting them to respond to us because they told us that, no, we're not looking at one source. We're looking at several sources for infrastructure investment. And we said, please put us in line for that as a Department of Health.
Okay. Minister, thank you so much for that. Just another quick one, Minister. These incidents and reports of food poisoning or alleged food poisoning at various schools specifically, we've seen what has been happening in summer townships as well. As the health department, what do you think could be done to avoid incidents of this nature? And I know that there has been the committee that has been set up, including a net joins, but that is obviously after the effect. But how do we prevent it?
Yes, Aldrin, you'll remember that I gave a progress report on the 28th, Monday, the 28th of October, where we disclosed that actually this is not food poisoning in the technical meaning of the word, of meaning bacterial contamination. We're dealing with a chemical here. We even identified it as turbophos. It's an organophosphate. We are dealing with organophosphate, which means it's a chemical agent. The question is, Where does it come from? How do people acquire it? How do we cut that line of supply? That is the question which the National Institute of Communicable Diseases, which discovered that it is organophosphate. That's the question they needed to answer. So what they did epidemiological mapping. They've been doing it actually. They are still continuing with that epidemiological mapping. They've been doing what is called oral postmortems, of following up people where somebody died, followed up what happened before, what happened after, where did they go to, etc., and map up those and go to laboratories and collect some more information about the results that may even have passed. In other words, to find the extent of this chemical in the country and how does it come about. Now, they have promised me that they will have finished that job by Monday and tell us, with recommendations, of course. But now those are about how to deal with the organophosphate that is already there. Now, your question is, how do we prevent this? Fortunately, Aldrin, you remember that we reported that when I was in Home Affairs, we called a 2-day workshop of metros, district councils, traditional leaders, the House of Traditional Leaders, and other government departments like housing, small business, DTIC, and local government. We said for 2 days in Beachwood. One of the things we said was that every spaza shop needs to be registered. And when you register, you must produce documents that show your legality in the country, or even if you are a South African, show identity documents. And then from there, the Department of Health will be able to show them what are the do's and don'ts in terms of health. Now, we needed a bylaw that will be used by all municipalities, and we asked POCTA to develop them. They've been doing that, and I got a report from Minister Tlhabisa yesterday that they finally finished the work, and there's been gazetting. Because what was missing was gazetting, meaning if it has been gazetted, it means spaza shops can now be legally registered or deregistered. And I think that work should start somewhere next week, because we can't wait anymore.
Yeah, very important. Minister, do you think that a state of emergency or a state of disaster should be declared?
Let me not respond to that now. We'll be able to respond to that question when they've given us the final report. What I'm reporting to you is preliminary, because I'm in touch with NICD every day. How far are they? Remember, we've still sent some samples to National Health Laboratory Services, samples which were taken in the spaza shops in Naledi and other areas where we think this poison could be. All those results are still outstanding, and I was told by Monday they will be able to say, here are the results. Then you'll see from that result, which showed the extent of the problem, the prevalence of this whole chemical, where it is, you'll be able to know whether it needs a state of emergency or something else. So I can't answer that question now.
Thank you so much for your time, Dr. Motsoaledi there, the Minister of Health, on looking at how the PIC can fund health infrastructure, but also concerns around reports of alleged food poisoning